Yeah. All right, so we're doing live. What's today? Wednesday? Tuesday? I don't know what today is. But this might be the most important video that I make for you to get your life back. This is step one, although technically it's 2 steps. But this is how we start our patients in our clinics. So this is how you at home can get your life back. Takes time, but if you focus on the principles, you can get better. We've been doing this for 35 years focused on back pain, 25 years treating back pain. The 2 most important steps to help you get your life back. That's me, Dr. Jeff. That's our disclaimer, so be aware. That's the disclaimer. The key to this process, or the key to the back pain, the complicated back pain, the back pain that's not going away, the people that comment on our YouTube page, it's not simple back pain. Simple back pain goes away by itself. But it's really about what causes the chronic back pain. And chronic back pain is pain that typically lasts more than 6 weeks to 3 months, because there is a process of healing that needs to take place, and if it doesn't heal in the proper amount of time, very often it becomes chronic. And there's a reason, and we know what the reason is, and you can solve it if you avoid it. It's not hard, okay? It takes time. Typical spine looks like this. It's not going to take long. I just need to talk you through one step. Typical spine looks like this. 24 vertebrae between the head and the hips. The vertebrae are the bones. In between each bone there is a disc. Now the key to back pain is the disc. And it's the disc because the disc is the weight-bearing structure. It moves. There's motion to the disc. In between each vertebrae there is a nerve that exits directly off of the spinal cord. And it's not uncommon that nerve can get pinched by the disc. Sciatica mostly is caused by the disc. Now, the disc is like a jelly donut in the sense that the outside of the disc there's a thick material. We call that the annulus. Inside the disc there's a jelly. It's called the nucleus. The nucleus can move around. And it's not uncommon that a lot of bending or sitting or your posture will start to cause the nucleus to push out. And as it pushes out, it'll start to aggravate and overload with stress the annulus. The annulus is cartilage, but that overloading of stress will cause the annulus to get inflamed. There's an inflammatory process. There's inflammation that takes place. But also during that time, you'll start to develop a little tear. It's the tearing of the annulus that allows the nucleus to push out. As it pushes out, what happens is you'll develop a bulging disc. So you get that tear, nucleus pushes out, you get a bulging disc. Over time, what happens is it herniates out further. Let's just, as we get past this, you'll understand the point, because it's a very, very, very important point. Sometimes what happens, as that tears like that, the nucleus will push out further, or it'll tear all the way through. That's called an extrusion. Now, when you have this process taking place, and there's an inflammatory process that takes place, you can get inflammation in the annulus, then you get the tearing. And the tearing, like any tissue, you tear any tissue in your body and you're going to get inflammation. So the key to this is what's happening with the inflammation. Inflammation has 2 phases. You've probably heard me talk about that. There's the initiation phase. When does it get initiated? It gets initiated when the load tolerance is beyond its limits and you start to get a little aggravation. There's an inflammatory process that takes place. Same thing when you get the tearing. That's the initiation. Now, once the initiation process starts, there's what we call the resolution phase. So the spine should heal in a certain amount of time. They don't always heal in that amount of time because of the motion and the load to the spine, but there's an initiation phase, and after the initiation phase is reached to a certain point, then there's a resolution phase. And what happens with the resolution phase is you'll start to develop certain cells that will activate certain process, and it will heal. The resolution phase is where the healing takes place. Kind of looks like this. There's an initiation phase, there's a sequence of events that take place in the initiation phase, and then there's a resolution phase. Now, the initiation phase tends to be a little bit more destructive. There's a breakdown process of the cells, and it's part of the healing, but if it continues, then it's a problem. And then with the resolution phase, it's really where the sort of the constructive phase, where the healing phase truly takes place. Okay, there's matrix synthesis, there's tissue remodeling. Up here, there's tissue destructive in the initiation phase. And this is what happens when you have chronic inflammation. Okay, because the spine moves, it's the motion of the spine that really causes the problem. So the key is, to try to avoid that, which is why we have the top 10 tips. But what happens over time with all this motion is the repetitive stress to the spine, this ongoing motion, causes chronic inflammation of the back, the pain that doesn't go away. The immune system starts to build up, and it never slows down, and it continues in the initiation phase because of the motion on the tear. And I've talked about this in the past. If you were to cut your hand and have an open wound there, and we were to sew it up, and then all day long you would do this, well, it would never heal. As a matter of fact, it would get more inflamed. It would get more aggravated. You've probably done that, where you've had something healing and you start to move it, so it hurts too much. Okay? That's the chronic inflammatory process. Well, the same thing happens to the spine. It's because the spine is designed to move in so many different directions. It's the chronic motion, or the continued motion on the aggravated tissue, that causes the aggravation. It causes the increase in inflammation. And then the tissues become super sensitive. You get sensitization of the discs, and it hurts more. It hurts more than normal. It hurts more than it normally would, because there's a lot of aggravation and inflammation. But you also start to develop inflammation in the nervous system. So you get this sensitization of the disc, where it's more sensitive to certain activities because now it's inflamed and aggravated and irritated, and it perpetuates. It's the perpetuation. And then you develop central sensitization. So you get sensitive in the disc, but you also get sensitive in the nervous system. And then the nerves are hyperactive. And when the nerves are hyperactive, that's when you start to develop an over sort of emphasis on the pain, where it hurts too much, because you start to get changes in the nervous system. You actually get active inflammation in the spinal cord, even though the problem and or the injury was not in the spinal cord. That's called sensitization. That's what happens when you have chronic back pain. So the normal phase of the initiation, as it's supposed to turn off, what happens is, as you're having motion to the joint, as that happens, you perpetuate the inflammatory process. So the resolution phase never finishes. There's never any resolution. Every time you hurt it, that's the pain that comes and goes. Every time you hurt it, you get more inflammation. Well, that inflammation, because it's destructive, leads to a weakness in the disc, and it gets weaker. And you never truly have the resolution phase. That's the chronic inflammation. It doesn't happen just in the disc. It'll happen in lots of your parts of your body. But again, our goal is to make sure that we can get it to the resolution phase. When you don't get the resolution phase, then the discs start to break down and they start to get weaker. So what's the point of all this? We have 10 tips. And everybody says, what are the 10 tips? Or they don't take the 10 tips seriously. They go, oh, I don't need that. Well, you do need it. You need exercise and you need strength to your spine, but you need to prevent the activities that are making it worse. You need to avoid the overloading of the discs, and you need to avoid the activities that are aggravating it. That's what the tips are. If you start to focus on what you're doing wrong that's aggravating the disc, then you can start to eliminate that inflammatory process or the perpetuation of the inflammation by moving in ways that's making it more aggravating, which causes the chronic inflammation. So we have tips. We have 10 tips. Okay, I'm going to put a link in this video that you can access. You can get those for free. Those are free. Okay, sometimes people think they're free and they don't want to do them because they're free. Okay, if you pay attention to this, you can start to get your life back. But also we use pro-resolving mediators, specialized pro-resolving mediators. What does that mean? Well, it's designed to decrease the inflammation. The tips are designed to avoid the activities that make it worse by aggravating the disc. Okay? There are very specific tips that we have you do that take the load off the disc. You have to take those seriously. But also, the specialized pro-resolving mediators have the ability to activate the resolution of the inflammation. It's cutting edge, brand new, Harvard discovery by a professor out of the Harvard Medical School. The pro-resolving mediators activates the resolution. So it actually activates the healing. Without it, you perpetuate the process. So our goal is to avoid the cycle of the initiation by the tips and the specialized pro-resolving mediators and activate the cycle of resolution. That's what helps you get your life back. Okay? There's some fantastic studies on the SPMs, the pro-resolving mediators, about how patients took the SPMs and took nothing else and did nothing else, and their pain started to get better. It affects a lot of different aspects of your life, the inflammatory process. A lot of cases of depression are the result of too much inflammation. Patients take the SPM, sometimes it alleviates their depression. It's an inflammatory process. Okay, again, we've been doing this 25 years. We treat some of the most severe back problems. The tips are very, very, very important. The SPMs are very, very, very important. We treat a lot of herniated disc. Okay, herniated disc, to eliminate the herniated disc, you have to decrease the inflammation. And you have to avoid the activities that make it worse. We have a mission. Our mission is to eliminate back pain from the planet. It can be done. With our studies, we've identified that probably 95 to 98% of all spinal surgeries are not necessary, and you can eliminate your back pain and live a normal, happy, healthy life. To get there, I want you to like this video. I want you to subscribe to our page. We need to get this information out. I want you to share this information, and I want you to add a comment. If you have any questions or comments, add them to the link, or add them below. In the description below, I'm going to put the link to the SPMs as well, and the tips. So today, if you call this number, we can give you a free consultation. You come in. If you can't make it in, go to the link. I don't think I remember the name of it. It's totalbackpainrelief.com/SPMS. I think. It'll be in the description. So that's it. Have a good day. Be careful. And do the tips. People don't take the tips seriously. They're very, very important.